Good morning. Welcome to day 2 of the Canadian Autism Leadership Summit. I'm really privileged and proud to be the co-chair of the Autism Alliance of Canada with Rebecca, who you met yesterday. And I want to reiterate what she said about how inspiring it is to be here convening and collaborating alongside so many leaders like yourselves. Rebecca was right when she said, together we get things done. And we celebrated that last night. Yesterday, we heard from the Deputy Grand Chief about the importance of working collectively. We are all here to advocate for the rights of autistic Canadians, so no matter where a person lives or who they are, they can access supports and services equally. Yesterday, we also heard from our international counterparts who are already implementing national strategies. We learned about what we can do as we move forward together. We learned that a strategy needs to be embedded in a rights-based, data-driven approach that includes specific outcome measures, because as Tanya said, what gets measured gets done. We learned that a national autism strategy needs to be practical, flexible, and responsive to the needs of autistic Canadians. We learned that we needed a funded infrastructure in place to move forward successfully. And we learned that infrastructure, we need to commit to diversity within it and include persons with first voice at the table to ensure that all voices at the table are heard. But we are also learned that we need to be prepared to compromise and to find solutions so that we can gain consensus to move forward effectively and in a timely manner. And then we also learned that every minute without progress is a lost opportunity for autistic Canadians. So we have exciting work to do. Today, we will build on the momentum of yesterday, and we will turn our focus inward and our minds towards what a national autism strategy means for our provinces and territories across Canada. What do we want from a national autism strategy? And more specifically, what do you need, or what does your organization need to ensure that a strategy works for you in your community, no matter where you live, no matter who you are, from coast to coast to coast? We are here in record numbers, physically and online, and we now need action. But good action is built on a solid foundation. So let's build this foundation together. You as an alliance, all of you as members are committed to a united front. The Autism Alliance of Canada is a network that can support us to learn from each other, support each other, and as Yvonne said so well yesterday, there you are, Yvonne, yeah, to make change together and to make the next steps a reality for this national autism strategy so it can come true. And together we can create a better landscape for autistic Canadians and their families across the country. So now I have the honor of introducing the Honorable Jean-Yves Duclos, Canada's Minister of Health. The Honorable Minister Duclos is a Canadian economist and a member of Parliament. He studied at the University of Alberta, where he obtained a bachelor's degree in economics, followed by graduate and doctoral studies in economics at the London School of Economics. He was a tenured professor at Université Laval, where he also was the director of the Department of Economics. Minister Duclos was the president-elect of the Canadian Economics Association and was elected a Fellow of the Royal Society of Canada in 2014. In 2015, Minister Duclos was elected to represent the riding of Quebec in the House of Commons. He has previously served as the president of the Treasury Board and Minister of Families, Children, and Social Development. I'd like you to welcome Minister Duclos. Thank you.
Bonjour à toutes et à tous. Merci Karen, merci Jonathan, merci Rebecca pour cette merveilleuse invitation et cette gentille introduction. Premièrement, je remercie évidemment l'Alliance canadienne de l'autisme de m'avoir gentiment invité sur le territoire traditionnel de la nation Anishinaabe algonquine pour participer à ce forum. Et je salue le militantisme solide dont l'Alliance fait preuve sans relâche au nom des Canadiens et des Canadiennes autistes et de leurs proches. Merci de me permettre d'être parmi tant de défenseurs passionnés, tous déterminés à rendre notre pays plus inclusif pour les personnes autistes. Votre partenariat et votre leadership sont inestimables pour travailler à améliorer la santé et le bien-être des Canadiennes et des Canadiens, de leurs familles et de leurs proches aidants. Nous avons, comme vous l'avez dit, Karen, un travail important à accomplir ensemble. With 2% of Canadian children and youth aged between 1 and 17 years of age diagnosed with autism, there is no doubt that Canada has a lot to gain by ensuring that autistic persons have the opportunity and the support they need and deserve to participate fully in our society. The experiences of autism can vary from person to person, and every person affected has its or her or his own strengths, talents, skills, and energy to share with our world. When autistic individuals are empowered to contribute to their communities, whatever it may be, whether it is at school, at work, in sports or recreation, we all win. And because equity and social inclusion and economic inclusion are beneficial to all of us. We must all do our part to help autistic Canadians therefore reach their full potential. And that is why we are working to improve Canadians' understanding of autism while laying the groundwork to better support the needs of autistic Canadians. It does, as Karen said, require teamwork to accomplish big things. And I thank my colleague, Mike Lake, Member of Parliament for Edmonton, Wetaskiwin, and other parliamentarians in the Senate and the House of Commons for their own commitment to making a difference for autistic Canadians and for sharing their own journey and their family's journey within the country. On March 30th, just a few weeks ago, Bill S-203, the Federal Framework on Autism Spectrum Act, received royal assent and became law. This legislation outlines a commitment for the development of a federal framework designed to support autistic Canadians, their families, and caregivers. It's one more step as progress continues and must continue toward the development of a national autism strategy. I know it's a process that many of you have been closely involved in and have been waiting for dearly and for a long time, and rightly so. I would like to thank the Autism Alliance of Canada for helping to drive progress and faster progress on this strategy through convening discussions like this leadership summit. Your insights, your advocacy, your leadership, and those of other stakeholders need to continue to shape the strategy as it is being developed and more quickly developed. As you will recall, we hosted a national autism conference last November, which brought together our partners in the autism community to collaborating and sharing knowledge. De plus, pour faire progresser notre compréhension de l'autisme, l'Académie canadienne des sciences de la santé a publié un rapport d'évaluation qui met en évidence les enjeux complexes auxquels sont confrontées les personnes autistes et leurs familles au pays. Le rapport est le fruit de 19 mois de travail par le groupe d'experts qui s'est fondé sur des données probantes et sur plus de 6000 consultations avec des Canadiens ayant vécu l'expérience de l'autisme. Je remercie toutes celles et tous ceux qui ont participé à ce gigantesque effort qui permet de guider nos travaux d'élaboration sur la stratégie nationale de l'autisme. In the meantime, we are investing and we need to keep investing in research that will further improve our understanding of autism and lead to innovative tools to support autistic Canadians, their families, and caregivers. That includes approximately $78 million over the last 5 years in research financed by the Canadian Institute of Health Research. And I take a moment to salute and to thank the work, and some of them more in this room, the work of scientists and experts that have been using and building on this support of the CIHR. Today, I'm also pleased to announce that the Government of Canada is providing close to $215,000 to the Autism Alliance of Canada for new research to address gaps in knowledge about the needs and experiences of autistic adults over the age of 30. That project will be led by the Autism Alliance of Canada in partnership with the CNIF Family Foundation, the Canadian Institute of Health Research, and McMaster University. And I want to, again, point to the fact that there were some of these McMaster talented researchers in the room today. Those findings will help inform further research and policy priorities, including for the National Autism Strategy. Ainsi, munis des meilleures connaissances et des meilleures données. Et on sait à quel point les connaissances et les données, c'est l'avenir de notre société dans plusieurs de ces dimensions, mais aussi et surtout l'avenir de la recherche et du travail clinique en matière de santé et en matière, entre autres, d'appui aux personnes autistes. Donc, avec des meilleures connaissances et des meilleures données, nous pourrons nous assurer que les personnes autistes, peu importe d'où elles viennent, peu importe qui elles peuvent être, obtiennent le soutien dont elles ont besoin pour s'épanouir pleinement au Canada en 2023. And finally, I'm cheating a bit because I'm going to quote directly from Karen. As she just said a moment ago, we have exciting work to do, whoever we may be in this room and elsewhere, united and supportive of each other, as you kindly said, making the next step a reality. Thank you, Karen. Thank you, everyone, and have a great day.
Thank you, Minister Duclos. So now I have the privilege of introducing to you the Director of Health Promotion and Chronic Disease Prevention Branch with the Public Health Agency of Canada, Mark Nafekh. Mark joined the Public Health Agency of Canada in 2020 as the Director General for the Centre of Chronic Disease Prevention and Health Equity, and is currently the Director of the Centre for Health Promotion. He has led his teams in implementing programs and policies that promote healthy living and prevent chronic disease through the lens of health equity. He also holds a champion role for equity, diversity, and inclusion, and ensures intersectional analyses are used to assess how diverse groups of people in Canada experience different policies, programs, and initiatives. Prior to joining the agency, Mark worked in a number of areas at the Correctional Services Canada, including research, evaluation, offender redress, and investigations into non-natural deaths in custody. He holds a master's degree in economics and continuously seeks learning opportunities in both his professional and personal endeavors. I'd like you to welcome Mark.
Good morning, everyone. Thank you for having me here today. I am grateful to have the opportunity to provide an update on the current status of the development of a national autism strategy for Canada as we embark on this last day of the Canadian Autism Leadership Summit. I'm Mark Nafekh, the Director General of the Centre for Health Promotion within the Public Health Agency of Canada. I am a middle-aged man of Middle East descent with no hair. Well, I guess I have the same haircut as our minister. Wearing thick black rimmed glasses, and I'm wearing a gray suit with a checkered blue and gray tie. I've been in this role since last October, though I have been with the agency for a number of years, advancing programs to address the root causes of health inequities. So I'm no stranger to the challenges and issues facing autistic Canadians. I've been asked to provide you with an update on our efforts to accelerate the development of a national autism strategy. As the Minister of Health, the Honorable Jean-Yves Duclos said earlier this morning, or just now, we all benefit when autistic individuals are empowered to contribute to the communities because equity and social inclusion are good for everyone. The federal commitment to develop a national autism strategy was first highlighted in the Minister of Health's mandate letter in 2019. It was reiterated again in 2021. However, the Government of Canada has been exploring ways to better support autistic Canadians over the past number of years through preliminary work undertaken with Autism Alliance of Canada on developing a blueprint for a national autism strategy. Budget 2018 provided $20 million over 5 years to support 2 new initiatives: the Autism and Intellectual Disability Knowledge Exchange Network, also known as AID Canada Network, and the Autism Spectrum Disorders Strategic Fund to support innovative community-based projects to support autistic Canadians and their families and caregivers. This was followed by a further investment of $15.4 million over 2 years announced in budget 2021 to enhance autism surveillance and activities, support further investments through the ASD Strategic Fund to address the impacts of the COVID-19 pandemic on autistic Canadians, and to support development of a national autism strategy. Over the past 18 months, we have been undertaking the policy work and engagement required to inform the development of the strategy. This has included our work with the Canadian Academy of Health Sciences in undertaking a comprehensive assessment on autism, as well as our National Autism Conference last November, which brought together key partners, stakeholders, and autistic Canadians to share their views on the priorities for action. And that is approximately when I joined this center, and that was one of my first activities, and is attending that conference. And what an amazing conference that was! And I have to say, we gathered a lot of very important information through that conference. And I want to thank everyone here today for their contributions to date and ongoing contributions to support us in our endeavors. So we've also been following the progress of Bill S-203 closely, which calls for the development of a federal framework on autism spectrum disorder. Now that the bill has received royal assent, we are developing a plan to support its implementation, taking into consideration the requirements for engagement outlined in the bill, as well as the specific measures that are to be included. These measures touch on important priorities outlined in the Canadian Academy of Health Sciences report and discussed at our National Autism Conference last fall, such as timely and equitable access to screening and diagnosis, financial support for autistic Canadians, their families and caregivers, culturally relevant tools and resources, a national public awareness campaign, and further research and data collection on autism in Canada. We see the federal framework on autism and the national autism strategy as being complementary. The framework will set out high-level guiding principles that provide a common policy direction for Canada, while the national autism strategy will serve as a multi-year strategic plan that sets out specific short and medium-term initiatives to advance key priorities identified in the framework. We will leverage the engagement we have already undertaken and the governance mechanisms we already have in place to support development of a national autism strategy. And we'll do that with provinces, territories, Indigenous organizations, to name a few, and all that to advance the development of a federal framework on autism. We will draw on the innovative ideas brought forward at the National Autism Conference on ways to move the bar forward on safety and security, on measures to strengthen financial literacy, ways to support autistic Canadians in the workplace, to address housing challenges, to strengthen health human resources, and support data, research, and evaluation as they pertain to the autistic community. An Indigenous-led engagement process on autism is also underway, in keeping with the Government of Canada's commitment to reconciliation and the right of Indigenous peoples to self-determination. We are working collaboratively with Employment and Social Development Canada on Indigenous-led engagement through national Indigenous organizations to inform both the National Autism Strategy and Canada's Disability Inclusion Action Plan. This engagement will inform the way forward for a distinctions-based approach in the National Autism Strategy that supports Indigenous-led initiatives for First Nations, Inuit, and Métis peoples on the autism spectrum. The National Autism Strategy will also capitalize on the key themes outlined in the CAHS report, which includes social inclusion, economic inclusion, evidence-based supports and services, and cross-cutting issues, including research. This will help to frame the areas for action. We also want to acknowledge the important investments that the federal government has already announced through the Disability Inclusion Action Plan. Federal investments in programs such as Ready, Willing, and Able will help autistic Canadians find employment. And these investments are just part of a broader employment strategy to improve labor force participation and improve financial security of persons with disabilities, including those with autism. As part of the Disability Inclusion Action Plan, the Department of Employment and Social Development Canada will also be making investments to make workplaces more accessible and inclusive. Legislation to establish the Canada Disability Benefit and make consequential amendments to the Income Tax Act is currently before the House of Commons. And once passed, the bill will reduce poverty and support the financial security of working age persons with disability. Our goals for the National Autism Strategy must be comprehensive and inclusive of each stage of life. We know more is required to support autistic adults and seniors, and this begins with understanding their needs. Minister Duclos announced earlier this morning a project being undertaken by the Autism Alliance of Canada to develop an autistic adult needs assessment survey. As you know, we are operating in a context of multi-jurisdictional responsibilities with efforts across many sectors, including health, education, social services, employment, housing, and more. So it is quite a complex endeavor, as important as it is. At both the federal, provincial, and territorial levels, we're taking an inventory of the wide range of existing programs and policies across Canada that exist to support autistic Canadians, their families, and caregivers. This includes autism-specific programming at the provincial and territorial level, such as autism diagnosis and behavioral supports, and also broader disability programming, such as employment supports, medical tax credits, access to assistive devices, supportive housing, and respite services for caregivers. We're looking to determine areas where the federal government can lead and where it can support the effectiveness of provincial and territorial initiatives. When the National Autism Strategy is released, Canada will join the international community who have already developed national autism strategies. This development will support both the UN Convention on the Rights of Persons with Disabilities and the Convention on the Rights of the Child. We are drawing on lessons learned and best practices from our international partners. The topics you have been discussing at this Canadian Autism Leadership Summit regarding international tools, policies, and best practices will help to further enrich the work we are undertaking on the development of the National Autism Strategy. I would like to thank the Autism Alliance of Canada for their leadership in this area. I'd like to thank the organizers of this event for bringing us together. We benefit tremendously from your exchange of ideas, expertise, and perspectives. I wish you continued success as you carry on with the summit today, and I look forward to hearing about the outcome of your discussions. Thank you very much.